Good morning, afternoon, and evening, depending on where you're at. Welcome to our Men's Health and Wellness presentation. I'm Kelly Rule, a physician that works at CVS Aetna and the Senior Medical Director with the Foreign Service Benefit Plan. So welcome again this morning, and I'm going to jump right into our presentation here. This is a quick overview of the things we'll be talking about today. The current state of affairs of men's health. We'll talk about some hot topics in men's health, key conditions, other wellness and prevention items, and health plan benefits and resources at the end of the presentation. And then we'll have a question and answer session at the end. If you have any questions, feel free to put them into the chat box in this presentation, and we'll follow them up at the end of the discussion. We'll also have a few quick poll questions during the presentation as well. First, for some very quick background, I just wanted to kind of go over some of my background. I'm, as I mentioned, the Senior Medical Director at the Foreign Service Plan. I'm working for CVS. My background is in family medicine. I'm also a flight surgeon in the Air Force, and that has helped quite a bit dealing with certain issues that we encounter with the Foreign Service Benefit Plan related to overseas issues and air evacuations and other considerations. I'm also on the board of advisors for the Men's Health Network, which is a DC-based nonprofit organization that was founded by Ron Henry, who is actually doing a presentation to Congress right now at this same time related to men's health. And that organization is focused on health and prevention with focus for men and boys on educational campaigns and other health opportunities. First, a quick highlight on Men's Health Awareness here, and happy Men's Health Week and Men's Health Month. Men's Health Week is always the week that ends with Father's Day, so happy early Father's Day as well for everyone, and happy International Men's Health Week as well. We have also Testicular Cancer Awareness Month in April, Prostate Cancer Awareness Month in September, and a lot of activities going on both congressionally and in the state and local areas. So there's been a lot of good efforts in place, and there's some growing efforts to increase awareness of important activities related to men's health. The first kind of key slide that I have related to the current state of affairs with men's health is a glimpse at the age gap in life expectancy or lifespan. And I have a few quick comments there that are important to note. So men are less likely to see a doctor in general for checkups compared to women. Men are more likely to be uninsured than women. Men die at higher rates than women for 9 of the top 10 causes of death. And there's other variability when you break down the statistics. But the key point, if you look at just one of those two bars, I mean, there is also the point to note that the life expectancy has decreased related to the pandemic and other issues. But what I wanted to highlight on this was the gap in age between the life expectancy for men and women. You'll see is a 6-year difference right there in 2021. And that's not just related to genetic factors. There's other factors involved in this and factors that are preventable. And so that's part of the point of our discussion, is to consider options to help improve and narrow this gap, improve health and narrow this gap. This slide shows an interesting graph of life expectancy over more than 200 years, going back to 1790. And you'll see that the gap in the life expectancy for men and women started to separate in around the 1890s. And it's about at that time as well that the lifespan started to rapidly rise in general for both. However, the gap has continued. It widened up to 8 years difference, and then it improved, and now it's back to around 6 years separation, as I mentioned. So, like I say, there's a lot of factors involved in this. It's not all easy to interpret, but it's not just genetics. There's preventable causes of this. This chart here, as far as highlighting our current state, this shows some of the leading causes of death in men. You'll see the top three are highlighted: heart disease, cancer, and accidents and injuries. And this has been fairly stable. A lot of this is preventable. For heart disease, there's lifestyle changes. For cancer, there's screening tests. For unintentional injuries, there's a lot of prevention that people can consider to reduce injuries. This slide here highlights the cancer rates of death between men and women, and this was in 2020 from CDC data. So you'll see that there's been a successful decline, and the 2020 data is a spot check there on the right of the 170 deaths per 100,000 for men, 125 for women, just to show you a glimpse of the difference. That's 50 more for men than women. However, the graph on the left there is a 20-year span, so you can see a good note that that overall the death rate from cancer is decreasing for both. Unfortunately, the gap is still fairly wide between men and women throughout, and that's related to a lot of factors, including the fact that oftentimes men tend to not get checked or screened as early as women do. So points to consider for improving the status of men's health overall. And the next section here I call hot topics, and so we're going to talk about a few hot topics in men's health, and after that we'll move on to key conditions. The first hot topic, of course, there's a lot of discussion always of prostate and prostate cancer, and one of my first concerns always is that I think a lot of people hear about it and talk about it but don't really know what it is. So you'll see on this slide that we have a image of the gland, of the prostate gland there. It sits just underneath the bladder, and it wraps around the tube that the urine passes through. So it produces fluid that's usually related to sexual activity, and it has muscles that push this fluid out. And but it's in an area that's notable because of some of the symptoms that it causes. And I have a quick poll question here. So for anyone that sees this pop up on their screen, feel free to put in a quick answer. If you're over 50 and you're a man, have you had a PSA test in the past 2 years? I just wanted to get a sampling to see how many people have had this, and we'll talk a little bit more about it. I'll just give it a little bit of time and see what kind of responses we get. And then we're going to talk a little bit about the screening and the frequency of screening and the recommendations for it. And this is a really complex topic. All right. So I'm going to jump over. Anyone else, you have 2 seconds to put in your response. All right. So it says that everyone who responded has had one, and that's interesting to note. Now I'll jump into a little bit of a discussion on it. We'll get back to that in just a moment. But thank you for your input on that. This is a quick overview of prostate health and the non-cancer issues. So BPH, benign prostatic hypertrophy, is related to the enlargement of the prostate that happens with age. And this leads to a lot of urinary symptoms, frequent urination, because it squeezes down on that tube where the urine passes through. Notably, this is underdiagnosed. There's a lot of men who are either not diagnosed or not treated, as I pointed out on that part of the slide there. And there are a lot of good treatments that can make the quality of life for men a lot better. So I urge everyone to keep that in mind and seek out help if they're noticing any trouble with urination, hesitancy, or difficulty urinating. Prostatitis, I also listed there as inflammation of the prostate. It's often infection, and the types of infection depend usually on age, and that can be treated with antibiotics. The items down below there are for general prostate health suggestions. You'll see saw palmetto. I just made a few quick comments down here on some common issues that come up. Saw palmetto used to be recommended for people with BPH as kind of a non-medication remedy, but we found with studies that it doesn't seem to help. Testosterone doesn't help with prostate health at all. And I put a few items there that might worsen prostate enlargement and help, just kind of for interest, but I won't spend too much time on that. Some of these items on these slides, this will be posted later. Feel free to review any of this at your leisure. Prostate cancer, of course, is the big topic, and that comes up in prostate health. And this is the most common non-skin cancer in American men. 1 in 7 men are born today are diagnosed with it, and 160,000 men are diagnosed with it each year. So it's a very common condition, very concerning. The challenge with it is, and has been for a number of years, is that screening for this is controversial. And so it's interesting to see that everybody on this survey has received the PSA test. The official recommendation, which we usually go by with the U.S. Preventive Health Services Task Force, doesn't really promote PSA testing because there's a lot of there's some risks to getting it, and there's only a limited benefit as far as reducing death and catching cancer before it spreads. A lot of people have the cancer and never have any symptoms, and never realize that they have it because oftentimes the advanced part of it happens, or death from it would occur after people have death from other causes. But if you are screened, and then the other item there relates to the fact that those who do get tested sometimes have complications from the testing, either complications from the biopsies, complications from treatment, other anxiety issues. So there's some concerns with getting tested. However, a lot of people still do the test, I'm aware. And the recommendation is a PSA test, a blood test, starting around age 55. That age has varied. It depends on the guidelines and the year. But right now, the recommendation is age 55 and stopping around age 70. And there's some other risk factors for prostate cancer, like family history. African Americans have a higher rate of prostate cancer as well. But the data is still controversial on how helpful it is to test before age 55, even if you're in a higher risk group. If you do get tested, the recommendation is every 1 to 2 years. And there also used to be a recommendation for a prostate rectal exam that has not been shown to really make any reductions in cancer or advanced disease, so that's no longer recommended. Testicular cancer is the other common form of cancer in men, younger men. It's the most common form, and from age 15 to 39, it's only 1% of cancers in men. It's very curable. So although it's definitely concerning and a difficult experience to go through if you have it, for the most cases it can be cured. The challenge with this, just like the PSA, there's not a good solid screening recommendation for it. There's no routine testing. They used to recommend self-exams or clinical exams with your doctor, but none of those have been shown to really reduce the mortality or the death from cancer or complications from it, from testicular cancer. Next, I'm going to be talking in a moment about the other hot topic, which is testosterone. Before that, I wanted to just mention some sexual health concerns. This is also a very important part of men's health, and that line there at the beginning is important to note that a lot of sexual issues are related to your overall health. So one key to good sexual health is having healthy diet, exercise, in controlling your other medical conditions as best you can. The first item there I mentioned, of course, is each of these items can be another presentation, basically, but that discusses prevention of infection in pregnancy, condoms, abstinence. There's a lot that can be said for that as far as maintaining sexual health. The second item there I talk about briefly is loss of libido or sex drive, and that's a concern for a variety of reasons there, and I listed a few of the potential causes related to medications and some other psychological issues, testosterone issues, relationship factors can play a role over time. So, and then the other item I put there was ED, erectile dysfunction, And there's some causes I listed there. There's many causes. Medications can definitely be a cause, and some other health conditions as well can relate to this. And I highlighted that just because there's a lot of good treatment options for that. And I listed a few of them in order down there, starting with healthy diet, good fitness, medications, vacuum devices, injections, and surgery also. There's a lot of good options. So this is my chance just to remind you, if you have any concerns with that, feel free to seek help. There are a lot of good treatments out there now. And this is the beginning of a few slides I have on testosterone. This is always a hot topic in testosterone supplementation. There's men's clinics that seem to have proliferated in certain areas, and they're a little bit different than a lot of the women's health or gynecology clinics. Some are very good. Others tend to focus on testosterone supplementation and the potential reimbursement they can get from this. So I've seen patients who've been put on testosterone that I'm concerned that they started on it. So one of my messages in this slide is that most people don't need it, and you should be very careful as far as considering when to start it. And there's some signs and symptoms listed there related to true low testosterone, and they can be significant if it's very low, related to low muscle mass, anemia, low bone density, decreased mood. And this can be related to medications, illnesses I listed below there. And on the bottom, I mentioned just that there's some decline with this, natural decline with testosterone over the lifespan. And the decline, the number decline, however, doesn't necessarily relate to symptoms for most men. And I just wanted to point out there is this health disparity here, gender health disparity related to some of the studies on this. The studies are fairly limited on both benefits and especially on risk for long-term testosterone use. And so the hope is that there'll continue to be further studies. For those who may be familiar with, there was a big study called the Women's Health Initiative that showed some problems with hormone replacement in women. And we used to recommend it for everyone years ago. And then after those big studies came out, we started to back off from recommending it for everyone. The other point with this is that testosterone, low testosterone, true low testosterone with symptoms is fairly rare. There was one study I mentioned here that showed people who had low testosterone and sexual health symptoms from the low testosterone was maybe at most 2% of men in that study. And if you, as far as who should test, we'll talk about that a little more in the next slide, but it's men who have symptoms, physical findings, lab findings. And again, I highlighted some of those more specific and less specific to low testosterone in the bottom there. Including low libido, other medical issues, anemia, and some less specific ones related to fatigue and depression. As far as testosterone testing, the keys to this are usually you should do a total serum testosterone rather than the specific components, and it should be done in the mornings, usually fasting, and a normal range is 300 to 800 nanograms per deciliter. If it's low or borderline low, it's good to repeat it. You shouldn't just go by one study. It's always good to do more than one, and just to confirm, and then you can do further testing if it does prove to be abnormal. And this last slide, commenting on testosterone here, highlights some of the treatment recommendations and benefits and risks. So the goal with this, if you are going to be on testosterone, is to have a combination of the low testosterone on the lab test plus symptoms that really support the fact that you have the low testosterone, and you should have a review with your doctor of the risks and the benefits. So it's not recommended to treat if you have a low blood level, but you don't really have symptoms. Let's say you've been screened and someone does a test, you've never noticed a problem, and your testosterone is low. You still don't need supplementation in that situation. Or if you have symptoms, but you don't have low testosterone, you also shouldn't be treated in that setting. There's still controversy on how much it relates to prostate cancer in some areas, but you should be careful if you have risk for prostate cancer as far as taking testosterone. If you're on testosterone, the level should be monitored. Your PSA, prostate cancer blood test should be checked, and you should have a check for anemia periodically. There's limited data on the benefits and the risks, and I have some of them highlighted in two of the boxes there. It's a variable improvement on some of those benefit items, and there's quite a few risks that people don't think about related to potential effects on vascular or heart disease, potential effects on the prostate, and other items. So it's good to kind of weigh the risks and the benefits before you start this, and to verify that you have the blood levels being abnormal and the symptoms matching that. Next, some key conditions in men's health, and the first one here is heart disease. And as you recall from hopefully from that prior slide, it's the most common cause of death in men. I mentioned there the other components. It's part of a component of cardiovascular disease, which includes high blood pressure, stroke, peripheral vascular disease. These are all effects on the arteries and blood vessels within the body. And then I highlighted some prevention down there: healthy diet, stopping smoking, controlling your other conditions like your blood pressure, diabetes, cholesterol, maintaining a healthy weight, exercising well. Those are all important. Key is to reduce your risk factors, focus on your lifestyle, healthy lifestyle, and use medication as needed. The combination of those three is good. Is the best way to prevent this. And aspirin, I just mentioned there, is not recommended for everyone. It used to be more widely used for, let's say, over 50, for everybody to be on that to help reduce their chances of heart disease. But there's been some concerns with bleeding, so people have backed off on that, and now it's kind of an individualized risk decision on when to use aspirin and when to not use it. This is a slide highlighting lung cancer, and this is the third most common cause of death in men, the second most common cancer death in men. The key to prevention of lung cancer, as we all have heard many times, is to stop tobacco use. Secondhand smoke has also played a role, and that's gotten better now with certain areas, restaurants and other areas limiting their use of smoking. There's some other more rare exposures that I have listed on there, and inflammatory conditions that can put people at risk. Wood smoke is also a risk for this, and that's a concern throughout other parts of the world where people still burn wood for their cooking. And then the other important item there, marijuana, and to a certain extent cocaine, and then kind of an unknown with e-cigs. All three of those are likely risk factors for lung cancer as well, but there's still studies are waiting to be further evaluated, and more participants are needed. So far, they've been fairly poor small studies. Younger participants, there's been a lot who've been on mixed. They use more than one, like the marijuana plus the cigarettes. So it's hard to kind of tease out what the effects are from each specific substance, but I think there's going to be more to come on data over the years, especially as marijuana is legalized in more and more states. And below that is the Preventive Health Services Task Force recommendation for screening. The only option we have right now, X-rays, chest X-rays really don't show anything. The recommendation is an annual low-dose CT scan if you're 50 to 80 and have a 20-pack year history, or you quit within 15 years. And a pack year is a pack a day for a year equivalent. So for those who smoke quite a bit, it's recommended from age 50 to 80 to get that scan. Colon cancer is the second most common cause of death in men and the most common cancer death in men. The risks are listed there. Prevention is listed there. It's a little bit less clear or easy, let's say, to be careful about preventing colon cancer than it is with the stopping smoking item for lung cancer. But there still are some options. Controlling other health issues. Tobacco still has an influence on this, and pain medicines sometimes help, although those are not recommended for true prevention. And then diet, you can focus on that a little bit, limiting your processed foods. Also, charred or darkened red meat seems to play a role in this and other forms of gastrointestinal or stomach cancer. So barbecued, blackened, or well done meat can play a role. Eating more vegetables is good, possibly bran. And the screening tests for colon cancer are listed down there on the bottom of the screen. It's recommended for people. It used to be 50. They've lowered the age because there's been more younger men that seem to be developing this. Ages 45 to 75 is now usually a recommendation for screening. Colonoscopy is the standard still every 10 years. Or there's several, and there's growing non-invasive tests for people who are just scared to have colonoscopy. I can assure you it's not that bad. If you go through it, you'll realize it's not a very difficult test to do. But for those who want to, there's stool tests, and I list two of them on there every 1 to 3 years. And there's the CT colonoscopy, which is a virtual scan as well. Mental health in men is an important consideration as well. And depression and anxiety are two of the most common conditions. And social phobia I mentioned on there is also a component of anxiety. Depression is underdiagnosed. It's important to note that men are just as likely to be depressed as women, and they're more likely to have a successful suicide attempt. Or to complete a suicide attempt, I should say. Generalized anxiety disorder is kind of the most common form of anxiety, but PTSD is also a big consideration. There's definitely women in these roles as well, but there's still more of a majority of men who are in the potentially the positions that have a high risk of traumatic events that can lead to PTSD in the military and firefighting, the police, and those on ambulances as well. And I have a few items here that I list related to recommendations for treatment. Of course, there's a lot to good treatment, but the key at the beginning there mentions if you have to start with yourself, and if you realize that you think you might have some concerns, don't hesitate to reach out for some help. Now there's a lot of awareness, less stigma, and a lot of people that can help. And you'll find often that if you do seek out some counseling or otherwise, it can make a big difference in your life. There's other important aspects to helping, just getting out a little bit more, exercising, trying to find things that you enjoy, prioritizing important activities, setting realistic goals for yourself, and being patient. All these things play a role. And there's a resource at the end that I'll mention, or that's in our resources, called Your Head Owner's Manual. That's by the Men's Health Network that has some good advice as well. And this slide has a few suggestions for another area of that I can include in mental health related to relationships. So on the left there, it discusses some of the thoughts for improving your father skills, and several of these have been mentioned in the media and other areas, but it's good to review it and think about it. Spending time is important with your children. Considering balancing your career with family time is important always, because life gets so busy. Try to be a good role model to your children. There's little things you can do, like eating together, making it a point to eat together with your family, making it a point to spend some time reading to your children. Just making an effort to spend time is always something important to do, and something that we have to be reminded of, because life is very busy nowadays. On the right there, I mentioned how to be a supportive partner, and there's all kinds of things you can do. These are just a few thoughts, but a random act of kindness every day, trying not to be too controlling, trying not to keep secrets and be on the same page with finances, being a good listener, devoting time to each other, and working on keeping things alive, romance and other things that you've always enjoyed. Takes a little bit of effort. a lot of effort sometimes. Sorry about the slide covering up the title on this. We couldn't quite figure out why that happened on this one, but this just highlights some comments related to the changes with aging and life cycle. So you'll see here a few thoughts related to aging. On the next slide, I talk a little bit more about the kind of classic midlife crisis. This slide just points out that with aging, there are some challenges, but there's also some benefits. Better emotional maturity, better ability to or capacity for intimacy, more privacy, often when the kids are out as they get older. And so and communication is important for this, and working on good communication between the partners is important to help maintain prior levels of enjoyment throughout the lifetime. Again, all these could be presentations on their own, basically, for an hour, but we're kind of just touching on all these topics. Midlife crisis right here, a highlight, which can happen in men and women, but it's often been talked about in men at the right age. These are some suggestions to help with that: taking time for yourself, reconnecting with friends and family, reflecting on the good and bad in life, staying active, considering projects and things you might like that you might want to get started with as you start to feel like maybe your work has been kind of the same over and over again, or other things in life have kind of gone on and gotten a little boring in your opinion. It's time to reconsider other things that you can do and still continue the other things, but find other ways to enjoy yourself as well and feel fulfilled and satisfied. And just like I mentioned on the other slide, if you feel like you need any help, it's a great to consider reaching out for some help. I just want to mention I'm a big Star Trek fan, and I think people don't realize how much help they can get from counseling or therapy. And as you'll notice on Star Trek: The Next Generation, anyone who used to watch that, they have a counselor, Counselor Troy, who sits next to the captain always and is very involved in all the activities and decisions, helping the crew, helping their interactions with other people. And I wish we would kind of follow that model a little more of getting help when we need it from someone in psychology. I'll quickly touch on wellness and prevention. I'm going to kind of move through this fairly quickly just to make sure that we stay on track with time. And first, I have another audience question here for the men in the audience. How many of you have had a general checkup or physical in the past 12 months? Feel free to give your input on this. And I'll give you a little while for people to put in a comment on here. This this is an important part of good preventive health. All right, I'm going to move over to the next slide. We'll see what we got so far. All right, so we have a fair number who have not had one in the past 12 months. And I usually recommend everyone try and get a general checkup every year. We still have a good number who did, so that's good. This slide covers some of the reasons that we as men don't always go to the doctor like we should. There's issues with socialization, big boys don't cry, attitudes, work obligations, lack of health insurance. There's lots of reasons men don't go as often as they should. A lot are in denial or just want to wait and hope that things will get better, but the longer you wait, usually they don't. Health has to be a priority always. And here's some other common excuses that I'm sure you'll recognize that are similar to some of the other things we discussed. People are kind of afraid to hear the facts. Some people just don't like to go to the doctor, don't have time. I can understand this is something you still have to force yourself to do. And here's some quick comments on general prevention. In a nutshell, good to get an annual exam, good to know your numbers and keep your own records as well. I think that's important for everyone to get a copy. They can print them off their portal if they have access to a portal with their doctor to get their lab results, things like that. Take an interest in it. Try to get things done early. You want to be screened for things like colon cancer ahead of time. And you don't want to wait also for your first physical when you get to 50. Even though we have that period of time where people feel healthy and don't like to go to the doctor, it's always good to still stay in contact because you may miss something. And take advantage of health screenings that you can get through the community or through your employer. And involve your family in your health as well. That can be an important part of motivating you. I have just a quick mention here of stress, and this can go under mental health or under wellness. Chronic stress is kind of the more common issue that I wanted to just talk about here, related to ongoing stress with job and family and relationships and finances. There's a lot of reasons we have stress in life, of course, and I pulled this from one of the Men's Health Network flyers as a one potential treatment, but it's not what I recommend for treating stress. Instead, I have a few suggestions on this next slide here. Healthy diet, exercise, easing up on the self-medication, caffeine, alcohol, getting a good night's sleep, relaxing, having some fun, getting outdoors, having some escapes from the stressful experiences and limiting them in your week. And on the right there, I mentioned there are some positive points, of course, to stress. It's not all bad. There's other good events that are stressful, like having a new child, getting married, working towards and getting a promotion, or a big presentation, anything else. Those can be stressful, but they are also important. Quick comment on diet and nutrition here. Over 60% of American men at least are overweight or obese. That number may be higher now. Men between the ages of 65 and 74 are the highest, but there's issues with that throughout for all ages. And this here is just a slide touching on the overall recommendations for diet and nutrition. And I mentioned there myplate.gov. Take a look at that, and take a look at that website if you'd like some general advice. Those of us who recall, I still have in my mind the food pyramid, which we've always used, and I used to see that in all the ads when I was a child. But that was replaced more than 10 years ago with this new recommendation. So you can go to this site and take a look at it. I'm just going to jump here to the next slide to keep us on track with time. How many servings of fruits and vegetables did you have yesterday? I wanted to do a quick poll on this, so we'll give you a few seconds to give me your input on this one. Just want to get an idea of the eating habits of the group here. I have a few responses. I'll wait a little bit longer. A reminder for anyone who has any questions, I know we're covering a lot of material. Feel free to type in some questions in the chat box, and we'll get to them at the end of the session. We've covered a lot of information and a lot of topics. All right, let's see where we're at on this one here. So most people should be able to get at least 5 servings of fruits and vegetables or more. So this just kind of gives us a glimpse of where a lot of us are at. We tend to not eat as many fruits and vegetables as we should in our diets. And in reality, this is very common. So, I do a lot of screening in clinic, and this is always an issue that people have trouble with getting enough of the fruits and vegetables and other aspects of a healthy diet. So a quick highlight here on nutrition. This is a little bit more detailed overview than what I mentioned on the prior slide. Important to note that if you are careful and kind of self-select for healthy foods, it will tend to lower your risks over time related to heart disease and other conditions. Key components are more fruits and vegetables, fiber, foods with low, what we call glycemic index, or foods that can raise your sugar levels, and diets that have healthy fats, things like plant-based oils like olive or canola oil are good. And omega-3 fatty acids, let's say from fish or plant sources, are good. If you're wondering where to begin with this, I always recommend the Mediterranean diet. And you can Google that and take a look at the components of it. It's usually a lot of fruits, vegetables, nuts, and seafood. That combination, if you can also research the history of Mediterranean diets, that's been shown to be used in areas where they found the populations have long lifespans and tend to be healthier for a longer period of time during their lifespan. So, and those who eat more fruits and vegetables tend to have less meat and saturated fat and other unhealthy components to their diet. Here's another question for you. I believe this is the last poll question for you. Do you exercise fairly vigorously 3 times a week? Yes or no? Be honest. We're just trying to get a kind of a little bit more of a feel for the state of affairs. All right, I'm going to wait a little bit longer here. See how many more responses we get. All right, so more than half, that's great. More than half, that's more than I expected. I think a lot of people now in our busy lives have a hard time exercising like we should. And I think this is an important part of long-term health. So I'm glad to see that and encourage everyone to try and exercise several times a week for sure. And just scanning the questions here. Feel free to send us any more questions. We'll be answering those pretty soon. Exercise and fitness here, just some quick comments. The key is to be doing something, to start off slow and gradually build it up. And, start off 2 or 3 times a week. If you can do it more, that's good. If you can do it 3 times a week for 20 minutes or more, that's very good, at least. And you can start with walking, and then you can consider other activities. And other things that you do, of course, are also useful. And you can do simple things like go up the stairs or walk further in the parking lots, things like that, to help yourself as well. Another important point to wellness that I didn't want to leave out is immunizations. Make sure you should be up to date on your COVID vaccines, flu vaccines. Tdap is tetanus, and or TD or Tdap, those are tetanus shots. And those are all important. HPV is a newer one it started out mostly for women, and then they've opened it up more for men as well. It's a human papillomavirus related to cervical cancer, genital warts. That's now being offered up to 26 and higher. And then if you're older, you should have your shingles, pneumonia, and RSV vaccines. Shingles for over 50, pneumonia over 65. Or earlier if you have any health risks. RSV was just approved. It's been in the news, you may have heard. And for RSV, that's going to be for people who are over 60, usually with other conditions like a weakened immunity or otherwise. That puts them at more risk for that viral lung infection. And then a quick comment on substance use and abuse in men. Just a little bit of an awareness slide. Men are more likely than women to use all types of illicit substances. This drug use and otherwise, is more likely to result in ER visits or overdose deaths for men than for women. For most age groups, men have a higher rate of use or dependence on these substances as well. And this is an interesting slide. Just look looking at the difference in accidents between men and women, you'll see here it's very interesting. I highlighted a few of these, and granted, this is deaths for a certain time period from CDC data. But if you think about the accidents and injuries that don't result in death, that's much higher, of course. And but just looking at this data, you can see quite a difference between men and women. You look there. Drowning, you have women with 1,000 deaths, men with almost 4,000. Firearm deaths in women 7,000, in men 42,000, and car accidents, women 12,000, men 32,000. There's quite a difference. So these are areas where we can look into ways to try and prevent these accidents and injuries. If you recall from one of the earlier slides, these accidents are the third leading cause of death in men, partly related to their activities and habits in society. It's a complex issue. And you'll notice on my title, I put from hormones to headphones on this presentation, because hearing loss, people may not think about it, but it's much more common in men than in women. And this is partly related still to louder hobbies and working environments that are more typical in men than in women. And unfortunately, it's a bad combination, because men are often less likely than women to seek help, less likely to talk about their hearing loss. And you'll notice some interesting differences down there between the types of hearing deficits in men and in women. Apologies on this title on this slide as well. This was a little glitch we couldn't figure out. But these are a quick comment here, a reminder of what's good to do for healthier, fuller lifestyles. See your doctor regularly, eat a healthy diet, exercise more, maintain a healthy weight, sleep well, manage your stress, get help if you need it. And another shout out there, just protecting yourself from skin cancer, limit your sun exposure. That's an issue in men and in women. And now finally, a quick comment just on health plan benefits and resources. With Foreign Service, we have a lot of members who are overseas. So I like to comment on that it's important here to follow the same standards when you can overseas as in the U.S. Resources are limited in many places, of course, but do your best. You can take advantage of telemedicine and other virtual ways to try and get advice and help, and some of that is well supported with the Foreign Service. Plan ahead to maximize your screening and your visits to the U.S. When you're in the U.S., let's say you're posting somewhere, but you're here in the U.S. for a little while, and then you're going back or starting something new. When you have a chance, you can get your screening and your visits done. And another key point is to learn what your local primary care site would be, and learn what your emergency site would be if you have a problem. And so learn that before you have a problem. And I'll share a personal experience. A while back, I was traveling in southern Germany, and I had a really bad experience with abdominal pain. Ended up being a tiny 3-millimeter kidney stone, but it was a horrible experience. And one of the biggest stresses was being in pain and trying to figure out where to go to get help. So it's good to identify the sites ahead of time when you're going to be overseas. And Foreign Service has some great benefits for that apply to overseas members. Men's health is a priority at Foreign Service as well. All the screening tests are covered, testosterone supplementation when needed, mental health coverage, lifestyle coaching, heart disease prevention, hearing aids. There's benefits for all of these, and as I said, for a lot of overseas benefits. So to make use of your benefits when you can, if you're a Foreign Service member. Finally, there are going to be some resources on the right side of your screen that you can make use of. You'll find these, the links will relate to a lot of the topics we talked about today. And there'll be a copy of the slides, as well as a recording of this presentation that'll be available. And there'll be Foreign Service resources available as well. And that concludes my presentation for today. I thank you all for listening. And now we'll go ahead and answer some of the questions.
Thank you, Dr. Roll. This was a great presentation. I think you covered a lot of topics that a lot of people have questions about. I just wanted to back up what you were saying about the reminder that a recording of this presentation will be available on AFSPA's YouTube page in about a week. Our YouTube is youtube.com/AFSPA cares. And also we do have the resources box on the right side of the screen, which has downloadable copy of the slides that you presented today, Dr. Rule. Thank you again. And also some other resources related to the presentation and the Foreign Service Benefit Plans resources for men's health. At this point, we're going to start answering some questions. If you have any more, please continue to put them in the Q&A box. We do have a couple here that we're going to get to right now, though. So Dr. Rule, the first one is, why should men stop prostate testing at 70 years old?
That's a good question. And all of the data, and that's emphasized if you look at the Preventive Health Services Task Force site. And I recommend anyone who's wondering about their screening test, take a look at that. U.S. Preventive Health Services Task Force. You can Google that and look at the guidelines. And they have a lot of background information that will go into very much more detail than you probably want on how they came to their conclusions. But they also discuss that specifically on there. It's felt that once you get to over 70, and this is a debate and a common issue with other things as well, like colon cancer screening. Once you reach age 70, if you haven't been positive and you're unlikely to have anything that you can really impact after age 70 based on current life expectancy. It's all statistical. So once you're over 70, you're not likely to find a cancer that will actually impact your life or that really needs to be treated, just because a lot of people end up having cancer who don't even realize that prostate cancer, and it never is an issue because they have other health conditions that impact them before the prostate cancer would. So basically over 70, all of the data and statistics show that it doesn't seem to make any difference as far as mortality or morbidity or catching advanced disease. And you can take a look at the Preventive Health Services task site if you want more information on that.
Okay, thank you for that. The next question is, what are your thoughts on supplementing testosterone levels after going through prostate cancer?
That's a complicated one, and so I want to be careful not to make too many specific health recommendations. So I'll give you some of my thoughts, but it's very, very important to talk to your doctor about that. If you've had prostate cancer, I would be very careful about taking testosterone. Just because there is this association, it seems, that there may be with testosterone and prostate cancer. So even though you've been treated, if there's any potential for recurrence, any let's say metastatic seeding of the cancer, otherwise that you weren't aware of or that wasn't treated for some reason during the initial treatment, there could be some influence on the testosterone use. And so I would say to be very cautious about doing that in that setting. That'd be my general opinion. And but outside of that, it would be best to talk to your doctor about that as well. And that's an interesting question. I'll take a little bit more of a look at the data and see if I can pass on any feedback through to the team that's helping with this presentation later.
Okay, thanks. The next question is related to the information that you provided about how many fruits and vegetables we should be eating a day, and it's what should my daily intake of calories be?
Of course, that depends on that varies a lot for age and whether you're male or female. And there are some charts that kind of give the recommended daily allowance. And so it's hard to say specifically for an individual person, just because it depends on each person as to what their amount is. The total amount of calories I believe is usually somewhere between 1,500 and 2,000 for most people. But that can vary widely depending on what your goal is as far as weight gain or weight loss, and like I say, your individual circumstances. So that'd be the only general comment that I could give on that.
Okay, thanks. The next one is there anything men can do to improve their chances of becoming a father?
Yes. So that I would take it that that relates to someone who's concerned about fertility issues if they're asking about that, and um, that's a tricky one as far as are there any let's say non-standard or alternative therapies that may help to boost your ability. For most people, there isn't anything that really has to be done or can be done that will make much of a difference. The issues with being fertility issues related to men are usually related to either sperm count or sperm activity, and so both of those in most settings are not really influenced by diet or other factors. So there's not anything specific that usually can be done. Now, if you're concerned that you feel like you're having trouble with pregnancy, then that would be a time to get testing to see if there's either a decrease in count or of sperm or decreased activity. And if you find that something's abnormal there, then there can be something that could be that you could have an impact on. And there's a lot of different techniques within the fertility clinics to try and improve that, and you can have in vitro fertilization and other things that will help to boost your chances if needed, just depending on how complex the issue is. So as far as general dietary supplements and otherwise, there's nothing really that I know of that has a lot of proven benefit to helping with that. But if you feel like you're having problems, and the standard is that you haven't been able to have a pregnancy after about 12 months of trying in younger ages, or 6 months of trying in older age groups, then it's worth doing a test to see whether it's you on the issues on your side or on your partner's side. And if you find anything abnormal, then you can try to figure out a way to impact that. So that's kind of the approach I would take. Other than that, I don't have any magic recommendation that will make that any better.
Okay, thank you. We have one more
Mhm.
question from a future father. It looks like somebody is expecting a baby boy. Congratulations. He would like to
Mhm.
know if there are any health considerations when considering circumcision for a newborn.
Mm. Um, Good question. So, health considerations. That's been it's interesting. We didn't focus there's so many topics within men's health, and I know I left out some, especially some health related to the pediatric side on this, and circumcision is one interesting topic. I think opinion on that has waxed and waned over the years, and it's definitely can be a important cultural factor for and varies in depending on different people's social and cultural and racial and ethnic and religious considerations as to how they approach that. Strictly speaking, from a health perspective, the there there can in most cases, it doesn't make too much of a difference whether you have a circumcision or not. The circumcision itself doesn't seem to be harmful in any way. There are usually not any significant complications or problems from it. There are potential health benefits from being circumcised. It's not really recommended to have a circumcision in general. It's no longer really a common practice just for health benefits, but potentially there are benefits to having a circumcision. There's less risk of infection in general, and rare forms of cancer also that can form related to that. So, but one of the common issues is you reduce risk of certain types of infections when you're circumcised compared to not circumcised. So, if someone is deciding whether or not to do it for some reason and has a strong motivation to do it, there are some potential health benefits over the long term to doing it.
Okay, thank you so much for that. It looks like we have one more question before we wrap up, and that
Mhm.
is, should I be concerned about getting up in the middle of the night to use the restroom?
If it's occasional and not very often, no, that still happens on a fairly common basis in most normal settings. So once in a while, that's okay. Once a night, that can be okay. If it's becoming more frequent, or if it's a change from before where you didn't have that situation, um, then that could be a concern. So it could be a sign of several different things, and prostate is one potential issue where your bladder doesn't empty completely, and so it seems to feel like it's getting full on a regular basis, and that's because the prostate is squeezing down on that urine tube and making it harder for the urine to get out. So yes, if that's frequent, then that's definitely something to be concerned about. Uh, it's not just prostate issues. There's other issues like diabetes and other causes where you can have an increased amount of urination and be waking up more regularly. And there's other considerations. I mean, things like are you drinking a lot of liquids or caffeine? Let's say closer to bedtime, that can lead to that. Caffeine is a diuretic to a certain extent, but if you drink lots of fluids, you'll end up waking up more at night. Things like that. That's why I say that's part of the normal realm. If it's from drinking fluids, then that's not as much of a concern. If it's once or once in a while, that's okay. If it's like I say, if it's more than once a night, if it's on a regular basis, then you can consider the potential for other causes that you might be able to find and treat that'll reduce your problem. So people vary a lot. Some people have more frequent urination or bowel movements than others. The habits are different person to person, but if you feel like you're starting to wake up more often at night, and then you won't it'd be good to talk to your doctor and see if there's anything that can be done just to analyze it and to potentially treat it. Infections are another consideration, chronic infections that can lead to that. There's a lot of considerations for it, and there's a lot of potential treatments for the prostate as well that can shrink the prostate and help you with that. So rather than just continue to wake up at night, talk to your doctor about it and see if there's any preventable or treatable reason for it.
Okay. Well, thank you so much for your extensive knowledge, Dr. Roll. We're going to go ahead and wrap up. We're a little afternoon right now, but we also want to thank everybody who attended the webinar today. Please check our events page on the website, afspa.org/events, for any upcoming member engagement that we have. We hope you enjoy the rest of your day. Bye.